Did we get everything? No. We had wanted to be able to do a little bit more management on our psychotropic drugs, and that legislation did not pass. The thing that we've done the most with, and I think it's the most critical both in the short term and the long term, is looking at the cost for all of our high cost users. So really focusing on those folks across all of our agencies, mental health, health and senior services, and social services, who cost a large amount per person, and trying to figure out why and seeing if we can't manage those costs better. So that was one of the main things that Lewin recommended. It was one of the things that we had kind of started on even before their recommendation. The reality of the Medicaid program is if it's a mandatory benefit, you have to provide it. The only non-mandatory benefits that have more than a thumbnail of money in them are prescription drugs and in-home services, personal care. You either provide prescriptions or you don't. And not providing prescription drugs to Medicaid clients, ultimately that's going to cost you more money than it saves you. You know, it really is. If you can't provide heart drugs and blood pressure medicine and asthma medication and all of that to clients, they're going to end up in the hospital. And it's just going to end up costing you more money. So it's not that we didn't look at benefit limits, but they make no sense. Federal health care legislation that passed had a lot of stuff in there. And one of them was basically they increased rebate percentages on generic drugs, but then said the federal government was going to get the benefit of all of that, not states. And since we in Missouri, as did other states, had already improved our rebate percentages on some of our drugs, basically what the federal government's going to do is take rebate money away from us, because they're now going to get the benefit of that. And it's going to cost a lot of states money, and we've calculated it's going to cost Missouri some money as well. So we, along with other states, are fighting, or arguing, I shouldn't say fighting, we're arguing with CMS's interpretation of how they're going to implement that, because it will cost us.
Containing Medicaid costs, moving in, so for next year, not only are we reducing provider payments, we're freezing provider payments.
Yes.
How are those two related?
For example, in nursing home, we're not giving them an increase. Typically they do get an increase most years. They're not getting an increase, but we're not reducing their payment. We are, however, other providers are seeing an actual reduction, just depending upon kind of where they stand to where they ought to be. We looked at each individual provider group independently. Right now, the federal government has given states what's called enhanced FMAP money. It's also called state fiscal relief money. It ends December of this year, so calendar year. After that, we'll go back to the regular match rate for the Medicaid program. That money has really helped Missouri get through. It's been one way that we've managed to get through this fiscal challenging time with no more cuts than we've had to do. Not that we've not had to make huge cuts, we have, but it's helped reduce the amount of cuts that we've had to make to the budget. That enhanced FMAP goes away, and we will have to transition back to not having that money. Right now the federal government is considering a 6-month extension of that, which would generate another $300 million for the state of Missouri. And if we get that, the governor and the legislature have agreed to set that aside for fiscal year 12, to make fiscal year 12 not as bad. And the reason we say fiscal year 12 is going to be so bad is that there is $860 million roughly of federal money built into the fiscal year 11 budget that goes away in fiscal year 12. So we'll be trying to balance our budget with $860 million less in federal money that has to be either made up with growth in general revenue or additional reductions to the budget. And so that $300 million would cushion that year a little bit.